right, just a couple people who are joining us. Okay, we'll go ahead and get started. Welcome everyone again. Welcome to our branch out session for today, managing pain flare-ups. So I'm gonna go ahead and get started. Where I want to start off first is a little bit about myself. So my name is Dr. Michael Arevalo, and I am a clinical psychologist. I'm also a consultant with Upside Health, and I am excited to be here with you all to present and talk about helpful tools in managing chronic pain. And again, our topic for today is going to be on managing pain flare-ups. So just a little bit about me before we begin. Again, I am a clinical psychologist and I do specialize in working with people with chronic pain, as well as overall health psychology. So what health psychology is, it's a branch within the field of psychology that focuses on how biological, psychological, and social factors impact chronic health conditions, including chronic pain. So again, that's how our biology, how our psychology, and how our social factors, our environmental factors impact us. I currently reside in Southern California, and I do practice as a pain psychologist. So here is an overview of our session for today of what we're going to be doing and what we're going to be talking about. So we're going to be talking briefly about the 4 systems of responding, and then we'll get into more of our session content. So we're going to be defining pain flares, understanding triggers for pain flares, and also understanding how pain flares can affect you. We'll talk about tips to help reduce pain flares, and then where I'm hoping to spend the most amount of time here is in pain flare-up management planning, and we'll talk about what's called a pain bag. We'll get to that in a little bit. All right, so let's start off first about talking about the 4 systems of responding. So if you've been to a branch out session before with Dr. John Sorrell, he does emphasize the 4 systems of responding during his branch out sessions. And I definitely want to be able to continue that and speak just briefly about it, because I also believe that these systems are very important and can be helpful for people. So if you have been to a previous branch out session, this may sound familiar and hopefully it can be a review. But if this is your first time at a branch out session, welcome. And hopefully this can be helpful in you understanding kind of the systems that are involved and go along with chronic pain. So there are 4 systems of responding, and the 4 system of responding is how we respond in multiple ways to our pain. Now, it's important to understand that there is a dual relationship because these specific areas can also affect our pain, which we're going to talk about more shortly as related to pain flare-ups. But just know that when somebody has pain, these 4 systems are responding, and also these 4 systems can go into pain as well. The first system, as you see from the PowerPoint up, the first system to respond is the physical system. So when people have pain, it's the physical system, and that includes your respiratory system, blood flow, heart rate, all of your body's physical responses come into play as a response to pain. There's also the emotional system. So there are often a variety of emotions that come along with experiencing chronic pain. That could be fear, anxiety, hopelessness, depression. And, at times it can be hard to see the other side of things, but hopefully we can work towards that of happiness and joy and gratitude. The third system of responding is our cognitive system, and cognitions are our thoughts. It's the thoughts that we have related to pain. It's our expectations, our hopes, our beliefs about pain, and it could even be our mindset. So how we approach situations and how our pain affects that situation, or how our pain is affected by certain situations. And then the last system to respond is the behavioral system. So the behavioral system is what we do as a result of chronic pain. So oftentimes behaviors that often happen can be avoidance, escape, there can be hesitance. And again, we want to be able to work towards engagement, approach, and connection. And again, I want to keep in mind that there is a dual relationship here with the four systems of responding. Our pain is affected by this, and also our pain can result in these. So there is a dynamic interaction between all of these systems. What you think affects how you feel, which affects how you behave, and your physical reactions can then result in feelings and thoughts. And all the arrows in this chart can definitely show that that there's an interplay of interactions between all these systems. They can influence and affect each other. And especially when pain is involved, it can also affect all these systems and affect everything. So getting more so into our material for today in managing pain flare-ups, I want to start first by defining pain flare-ups. Now, I'm sure many of you here are very familiar about what a pain flare-up is, but I want to be able to look more so towards the textbook definition of a pain flare-up because maybe some people are not familiar with it. So what is a pain flare? A pain flare is a more severe episode of a pre-existing condition that eventually subsides. And that's the emphasis that I want to put here in defining a pain flare. It's those last three words, that eventually subsides. Now, unfortunately, it's really, really hard to say how long a pain flare would last, especially taking into account what pain you're experiencing specifically, as well as individual differences. But it will eventually subside. And especially being in an active pain flare-up, it can definitely feel like it's never going to end. Some pain flares may be the same, some pain flares may be different, but not all pain flares will be in that way. A pain flare can last somewhere between a couple of hours. A pain flare can last days, weeks, sometimes unfortunately even months. It's important that you all understand that pain flares are on a spectrum, right? There can be more minor pain flares and there can be more major pain flares. So those minor pain flares can be something like if we reach for something and that increases our pain. So our pain goes up from our baseline and it maybe lasts a couple hours, maybe it'll subside or go down a little bit by the end of the day. Those can be more of the minor pain flares on one end of the spectrum. But the other end of the spectrum can be more of those major pain flares. So for example, waking up with pain on a scale of 8 out of 10 in the morning, or doing a lot of activity the day before and it's completely hard to move the next day, or it's hard to kind of roll out of bed or do the things that you used to be as a result of a lot of activities that you're doing. So there can be more major pain flares as well. So the key point here is that pain flares are on a spectrum. They will eventually subside. And it really depends on the person, their pain, and how they manage the pain about how long it will last. But it's definitely hard to say how long a pain flare will last specifically. But what we can do is we can understand more about the triggers for our pain flares. Knowledge is definitely going to be power in terms of pain management. It can be very, very helpful to understand what your triggers for a pain flare are. There can be physical triggers, mental triggers, as well as emotional triggers that can start up a pain flare. So physical triggers can be doing too much activity at one time. If you are a parent of young children, maybe you're rough and tumbling with the kids, that can definitely be a physical trigger that can go into a pain flare-up. Maybe if you push yourself a little bit too much, that can be a physical trigger. Maybe if you're bending or reaching or doing something that you wouldn't normally do, or like overextending yourself or staying in one position for too long. So sitting for long periods of time, standing for long periods of time, having a little bit of a stiffness, all of those things can be physical triggers that can increase or start a pain flare-up. There can also be mental triggers for pain flare-ups. Remember the dynamic interaction of the 4 ways of responding that I spoke about previously. Mental triggers, our cognitions, our thoughts, that can all go into a pain flare-up as well. So mental triggers can be negative thinking. Our thoughts are very, very powerful. And if you've been to any of the other branch out sessions with Dr. John Sorrell, he has spoken about how powerful our thinking is. And if you haven't had an opportunity, please engage in the branch platform. We have a lot of content on there that talks about the power of thinking, and hopefully we can have some more things for you along the way for people who are new here. But our thoughts are so powerful, they can go into an active pain flare up. So having thoughts, for example, like, I will never be able to do anything because of my pain. I am useless. I am worthless. Nobody considers me. Nobody validates me. Like, these are all things that can go into an active pain flare up. Again, that dynamic interaction of things. And then there can also be emotional triggers for pain. So emotional triggers can lead to pain flare-ups. It can be increased stress, anxiety, depression. There can also be external things that cause emotions that impact our pain. So for example, if you're late for work and you're rushing around all over the place, if you're sitting in traffic, those can be external stressors, emotional triggers that come out as a result of all that. Or even having family members, friends or family members who may not be empathetic or validating for you, that can also be very upsetting, and that can also be an emotional trigger for having a pain flare up. It can also be very helpful to understand how pain flare ups can affect you personally. So it's great to know the triggers that go into our pain flare ups, but how does it affect you and your interactions with others? How it affects you, your interaction with others, as well as how you view the world around you. And just like how triggers can be physical, mental, as well as emotional, pain flares can also affect you in those areas as well. So when somebody has increased pain, it could affect you physically. You could have a lot more muscle tension, feeling that tightness around your body. There can also be a lot of difficulty with movement. It's going to be harder to move around. Maybe you'll feel more fatigued. Maybe you'll more so slow down. So there can be a physical impact on you as a result of your pain flare up. And pain can also affect you mentally, which I'm sure many people can recognize, right? There could be increasing negative thoughts and negative thinking when we're in an active pain flare up. This will never end. I will never be able to do anything again. My pain will never go back to baseline. This is going to be my life now, right? A lot of the thoughts can be, it can come, a lot of negative thinking can come as a result of active pain flare ups, and that can affect us. And then pain can also affect you emotionally. It can increase. And the way I like to explain it, I like to explain pain as a volume, right? Like, there are things that turn up the volume on chronic pain, and there can be things that turn down the volume on chronic pain. When the volume is cranked up on chronic pain, then it increases our worry, it increases our anxiety about it, depression, that you have feelings of anger, frustration. There could be a lot that we're affected emotionally as a result of our pain. So let's talk a little bit generally quickly about tips to help reduce pain flare-ups. So something that can be helpful for people is to pause. And I know in the midst of a pain flare-up, that can be so difficult to do. But if we're able to just pause and pay attention, what went into the pain flare-ups, how is it affecting us, then maybe we can find other ways that we can help manage the pain flare-up at that time. You can take a break, maybe get some light, gentle movement in there. There's a saying in chronic pain management that motion is lotion. I remember when I used to work with a physical medicine physician. He was a pain physician, and I was a pain psychologist. In one of the medical units I was working on, he would walk up and down the hall and say, "Motion is lotion, people. Motion is lotion." Dr. Revlo, motion is lotion. I say, "Yes, doc. Yep, motion is lotion. I got it." Easy, gentle movement can at times be helpful for chronic pain. It can be helpful for maybe those minor pain flare-ups, and sometimes for the major ones, but major ones, there can also be other ways to manage that pain flare-up at that time. You can engage in deep breathing. I'm talking about that deep diaphragmatic breathing, that belly breathing. Dr. Sorrell spoke a little bit about that previously in the past at other branch out sessions, but having that diaphragmatic breathing is truly important. That can really go a long way, especially in easing a pain flare-up. You can massage areas of tension. You can apply ice and heat in a way that's helpful for you. Find a comfortable position. Do your best to stay calm and reassure yourself to help ease that stress response. You could also use positive self-talk that, I can get through this, have a mantra for yourself. And then meditation is huge, practicing meditation. And I will have a series or speak a little bit, maybe another branch out session to talk about how helpful meditation can be in managing chronic pain. But let's talk about pain flare-up management planning. So I want to be aware of time because I definitely want to be able to have an opportunity for people to ask questions at the end of this. But this is, I think, can be helpful too. So something that could also be helpful for managing pain flare-ups is having a pain flare-up management plan. Having a plan, it can be very, very helpful. The analogy I like to use is with emergency exit signs in buildings. Right? Whenever we go in buildings, we often see an emergency exit and it guides you to an arrow path about where to go, where the exit is in the case of a fire, any kind of emergency. Now, a big reason why buildings have those is for building codes, of course, but another reason why buildings have those exit signs is because in the midst of an emergency, sometimes it could be really hard to remember what's the best route, what's the best path, because we're attending to the emergency at that time. You see, pain flare-ups can be considered a pain emergency, right? So pain flare-ups are overwhelming, and sometimes it can be very hard to remember what can be helpful to reduce the pain in that moment. A lot of people already know about what can be helpful for managing their pain flare-ups, but when they're in the midst of one of those more severe pain flare-ups, sometimes it could be hard to remember, and having a concrete plan can be helpful for you. So you could just go to a list and be like, all right, let me just do all of these things to see if it can help at all whatsoever. Having a concrete plan can be a helpful tool. It can be a helpful tool for managing your chronic pain. And there are a variety of ways to have pain flare-up management plans. Some people take notes on their phone about what could be helpful. Some people write it down. Some people go very specifically about people to call. It can be a list of 5 things that you can do. It can have places to go, people to talk to. For me personally, I just always encourage people to have a plan that is helpful for you and personalized for you. So I often recommend that people write down 10 things that can be helpful for your pain, right? So just maybe it's, deep breathing, taking a hot bath. Maybe it's massaging. Maybe it's watching an episode of my favorite show. So some kind of distraction, right? So just make a list of 10 things that are helpful for you, and then take the first 4 and put that at the bottom of the list. So you have 14 things on your pain flare-up management plan. The reason why you take the first 4 and put it at the bottom is because maybe those first 4 weren't helpful when you did it the first time around, but it could possibly be helpful when you do it again later on when you're working your way down your list. Ideally, if somebody is in an active pain flare-up, it'd be great to have something where I can just grab a piece of paper or grab my phone, look at my list and say, okay, number 1, apply ice, did that. Number 2, apply heat, did that. Still in pain, still really bad. Number 3, massage. Okay, I did that. Number 4, use my TENS unit. Okay, did that. Still in pain, still really bad. Number 5, take a walk if able to. Okay, can I take a walk? I don't think that's something I can do right now. Okay, that's okay. What's next on the list? Listening to music. Let me try listening to music right now. Do a meditation, maybe laying down for a bit, drinking a glass of water, taking a hot shower, right? These are all things that you can be able to make your way down the list in an active pain flare-up, so you could have kind of a plan to stick to. I always encourage people to write it down, whether it's on their phone or whether it's on a piece of paper, but just being able to have it where you can easily reference can be helpful. Remember, same thing about building codes, right? We want to be able to access something when an emergency comes up, and that can be a great place to have it, is whether it's on your phone, on a piece of paper on the refrigerator, on a piece of paper by your desk, something that's easily accessible. Also, what could be really helpful in terms of managing pain flare-ups is having a pain bag. So basically a pain bag is like an emergency prepared kit for chronic pain. It's an emergency bag for pain. And we have that so many times in other places of our lives. So as I mentioned, I reside in Southern California. I grew up I was born and raised in Southern California. We often had earthquake drills and earthquake emergency kits in our school systems. And we would create a kit whenever there was an earthquake, things that we need. You can use a pain bag and have a kit, to be able to manage your pain if you were outside of the community, right? And you could fill it in everything that's helpful for you. The best example I think of is somebody I worked in early on in creating a pain bag. And what this person did is in their pain bag, they had one of those massage guns, they had a TENS unit, they had a thermos kept with cold water, icy cold water. They had one of those instant heat pads, one of those instant ice pads, and they had headphones. And what they would do is if they were out in the community, if they were in the grocery store and they had an active pain flare up, they would just go to their car, take out their pain bag, and apply heat, apply ice, and do things that they need to take care of themselves and manage that, and managing that pain in that moment, and managing that pain flare up. What's interesting is that just knowing that there's some kind of relief kept beside you at a moment's notice with that pain bag, it can be helpful in minimizing pain flare-ups. So something to help keep in mind for people, and another idea for people in managing their pain day to day. So really quick, so the last things to consider, questions for you to consider and hopefully take away from this session from today are, start thinking about what are your triggers for a pain flare-up? How does a pain flare-up affect you? And what can be your plan for a pain flare-up? What are some things that you can do? And if you're interested in creating a pain bag for yourself to take with you in your car, in the community, what are some things that you can put inside the bag that can be most helpful? I am aware of time. I want to make sure that we have enough time for questions. So I'm going to stop sharing my PowerPoint at this time, and hopefully we can stop the recording so we can field some questions. Okay, I'm going to stop the recording.